All right there. Hey everybody. Today is April 3rd, 2013, and I had my third and my final pre-op appointment today. So I'm going to tell you how that went, but I wanted to touch base on a couple things that I think I forgot to mention in the last video when I talked about tips for having an ostomy and dealing with that. Number one, I had said I had like 4 or 5 leaks, and not only was it partly because of the seal that I was using, and I had to adjust to figure out the best type of putty or paste to get around my stoma to seal that and make sure I had the right size flange, but also initially after surgery the stoma seemed to be pulling away from the skin, so I was using a lot of stoma powder. And stoma powder is really good if there's weepy areas, but if you use too much, even with the no-stick skin prep, it can still cause a problem for the barriers to stick. And I think that's what was happening. I was being a little overzealous on the stoma powder to try and heal the skin quicker. And by doing that, I was actually doing myself a disservice because things weren't sticking as well. So now that things have healed up, I don't use the stoma powder anymore because I don't need to, and the barriers and the flanges have been sticking fine. I've been getting 5 or 6 days before I have to change, so I wanted to mention that. And also, I think I forgot to mention, since the surgery, even though I have the ostomy, I have been passing mucus still out my backside, very watery mucus, which is, they said it's completely normal, but I do sometimes get the urge, like I have to go to the bathroom, but I can hold it. It's not a urgent urge, and I can tell when things are passing. So I guess it's kind of probably a good thing because I get I'm already getting to learn a little bit of what this is going to feel like when I have to go to the bathroom and what it feels like to pass something through the new pouch and things. So I forgot to mention those 2 things, so I wanted to do that. But like I said, today was my pre-op appointment for the takedown of my ileostomy, which is next Monday. Today is Wednesday. And I had at 9:30 this morning, I had an appointment in the radiology department for what's called a dynamic proctography exam. And that is where they shoot barium up inside the pouch and they check for leaks and everything. So the experience wasn't as bad as I thought it was going to be. It wasn't painful at all. But normally, like if you go to have an x-ray or an MRI, you have, I think they're techs, x-ray techs, and then the physician would read the report or read the exam and then put a report together. But for this exam, because it's such a specific, precise type of exam, the doctor, the radiologist, is actually the one administering the test. So I had a doctor, I'll leave his name out of it. He was a tad odd, I will say, but he's been doing these types of exams, I'm sure on top of other things, for 25 or 30 years. So he's excellent at what he does, which is what I want, is a phenomenal set of eyes. But first of all, you have to go in the back and you have to change into a gown, strip down except for shoes and socks, and then put a gown on. And of course on me, I'm 6'3", so these gowns are like mini skirts. So there's people in the waiting area. I'm not comfortable sitting down because there's no way to cover the goods. So I'm just kind of standing around. They ended up being a half hour late to get the test going. But I get into the exam room, the radiology room, and the doctor comes out, and I have my stealth belt on, and it's a radiology exam. I know it's kind of just an x-ray, but I didn't know there's metal on my zipper and stuff, and I didn't know if that would interfere with anything. So I know there's going to be a barium enema involved, and I know that I'm going to have to pass some of it out so they can check to make sure the pouch is good and everything. So I simply asked the guy, how messy is this going to get? Because I wanted to tell him I'll take my stealth belt off if it's going to get messy. And he launches into this long ass litany about Dr. Kirshner, who was the father of IBD from way back when, and did evaluations on the psychology portion of people with IBD and the psychological component. And he found that one of the components in the psyche of these people is they're very fastidious and precise and exact, and almost made it sound like OCD. He's just launching into this long talk about this crap that, okay, it's kind of interesting, but it was a little offensive because I kind of felt like, dude, I'm just asking how messy it's going to get if I need to take my stealth belt off. I do happen to be very clean, of course, and I could see how there is a correlation between, I guess, sort of a type A personality. But then he explained, I'm not saying it's a cause, but if you happen to have these diseases, I guess they could exacerbate symptoms or whatever. And obviously that's why he's a radiologist, and I think he has relatively minimal patient contact except for these exams. And just using like big words when he's describing things. You can't really get a word in edgewise. And anyways, he really knew what he was doing, so I was thankful for that. So I called up on the table, explained what he was going to do. Basically, they inserted a catheter in my rear end, and he said it's considered a 16 French, which is the size, 16 French. And I found out later it's not the same as 16 gauge when you're talking about needles, so it's different. But I guess 16 French is the normal size they use. So he told me that's a good sign. I could get the 16 French size catheter in. That means the surgeon won't have to do any dilation of the anal muscles in there of the sphincter. If we have to go down to a 14, then usually the surgeon may have to do some dilation with his finger. If we have to go smaller than that, usually they have to use a special device when you're under anesthetic and stretch out, the sphincter muscles. So I'm like, oh, okay, that's great. It's no manual stretching of anything. It's a good thing. So I was laying on my left side. He said he inserted 60 cc's of the barium. He put me on my side to put the catheter in. Then I went on my stomach. Then he put the barium in. And I was able to actually see on the screen. It was kind of cool, actually. You could see the barium go in and fill the Jpouch and go up through the small intestine. He kind of pointed out some things, and then he had me roll from my stomach to my left side, then all the way to my back. Then the table actually elevated, so I was flat, but then I started going almost at a 45-degree angle towards standing. So he could see all the barium fill the Jpouch in the dependent position. And they were also putting air in at the same time to kind of dilate the small intestine. And he had a radiology student with him, so he was explaining everything. And one of the things I was glad to hear him say to the student is that when we're putting the air in the small intestine, you have to remember that there's an ostomy bag at the other end of this. So if you put too much air in and don't release some of it as you take your pictures and stuff, you can actually put so much air in that you pop the ostomy bag. So, he was telling the student you want to be aware of this when you're doing these exams in the future. So that was good to hear that, like I said, he really knows what he was doing. I felt like I was in very good hands. There's no leakage at all. He said the sutures are good. The incision where they sewed everything together was good. He was actually able to get dye all the way up to my ostomy bag, basically, easily. So he said that's good. Things are open and clear. He did say there's one area that looks like there might be a small adhesion along the small bowel. He said nothing to worry about or be concerned about because I asked him about it. He said, but if you get 6 months out down the road and you notice you're having trouble passing stool or maybe getting blockage, you'll want to remember that, oh, we saw that when we did the proctography, because that could be a cause. It may not be. But he said it'll be noted in the report. So that was it. It was that simple. And then I got up and went and sat on the toilet to just kind of empty as much barium out as I could. Feel a little weird about it. I know I've had barium, I've had to swallow it before, and they tell you to drink a lot of water that day to clear it out of your system, but this is kind of a closed system down there right now, so there's no way to empty it, to rinse it out. But obviously they do this, so that's the way it is. So I went to the bathroom and emptied a lot of the barium out and got dressed, and then went up to my appointment, my pre-op appointment with the surgeon. So that went really well. They were quite a bit behind today, like an hour and a half. I've never had to wait that long for them, but I guess Dr. Hurst has been on vacation, so he just came back, so I think they were getting caught up. But glad to hear he was on vacation right before my surgery, because that means I get very, very fresh hands next Monday. Anyway, so Dr. Hurst came in. I can't say enough about the man. Still just thoroughly impressed with him. Very personable, wonderful bedside manner. You can tell he just likes what he does, and he enjoys talking with the patients and stuff. So he answered my questions. I wrote some of them down. I asked how long the surgery will be. He said the surgery itself is probably about an hour, hour and a half. But then there's prep time in the operating room beforehand, and then, cleanup time afterwards. So I might be in there for maybe 3 hours or so. But the actual surgery should only take about an hour, hour and a half. I also asked him about when they close the incision, what happens with that. And he said, well, there's two different things that can happen. One is they try to keep, a relatively small circumference where the bowel's been out. And as long as they can sew everything together and tuck the bowel back in, what they do is, he said, they use a special stitching method around that circle and then pull it tight. And then the very center, he said, is slightly open, which scabs over very quickly, and then the scab falls off. And the scar is much less, as opposed to if they need to enlarge that circle a little more to see what they're doing, or to stitch a little better on the small bowel. He said then, if they have to enlarge that, they may have to end up making the incision a little bit bigger and then stapling the incision closed. But he won't know until we do surgery on Monday exactly what methods are going to be there. So staples would obviously have to be removed in a couple weeks. The sutures would just dissolve on their own. So I'm hoping for sutures, but we'll see what happens. Also, I asked him about, because this is, I've heard the term a dirty incision, because you have waste around an incision, the concern for infection. And he said, yes, that is correct, but it's no more of a risk than the other surgeries that we've done anytime you're dealing with the intestine. He didn't sound concerned about it. Obviously, it's a precaution that they're going to monitor for, but it didn't sound like there's a huge concern about the incision becoming infected after this. He said the pain will be much less than what I had last time, so I wasn't too uncomfortable last time, but I'm definitely going to tell the anesthesiologist I do not want morphine at all. I want the Dilaudid and not the morphine. I just don't like the way the morphine makes me feel. And the Dilaudid seems to work very well for me, so I'm going to make sure I mention that to the anesthesiologist on Monday. I also asked him about the possibility of there being more trouble or more concern for a small bowel obstruction after this surgery, because they're physically sewing the bowel back together in that area, and I didn't know if there's kind of more scar tissue that could build up there, and then I'm going to have stool passing through the whole intestine now, and he said no, there's really no more risk for that now than there was previously, so that was good to know. He did say I will have a catheter until I get up and get moving around. They've tentatively said, figure 5 to 7 days, but again, everybody's different. The main thing is I have to wait for the bowel to wake up again after surgery. Wesley, my friend down in Georgia, Atlanta, who today is actually 2 weeks since his takedown, he had his surgery on a Wednesday. He was home Friday night. So we'll see how quickly I can get out of there and get back home. What else? Oh, the surgeon did do a rectal exam with his finger while I was in the office. And obviously his finger is larger than a 16 French catheter because it was very uncomfortable. And he described it as a moderate stricture. I think that's the right word. Basically, and he said it's very normal because they sewed those pieces together, so as they healed, they shrunk in diameter, which is, he said, very normal. But during my surgery Monday, he's going to do a manual with his finger dilation of that area. He said that should be fine to take care of it. It's not that big a deal, and it's not uncommon. So I'm glad that he's going to do it while I'm under anesthetic because it was, like I said, it was not pleasant. So I think that's about it in prep for surgery Monday. I already know that once my bowel does wake up, the output that I'm going to be passing, especially initially, is going to be very acidic because now that there's no colon, the output is closer to my stomach, so there's going to be more stomach acid in the output. And initially, there's not a lot of food or anything to combat that acid. So what can happen is your butt cheeks can develop what's called buttburn after surgery because I'll be going frequently, it's more acidic, you're wiping, it becomes raw, blah, blah, blah. So there's this ointment called calmoseptine. It kind of reminds me of like vitamin D ointment or butt paste for babies, that sort of thing. But it has menthol in it, which is sort of an anti-itch, antiseptic type thing. And then I forget what the other ingredient is, but basically it's supposed to provide a barrier to the skin so the skin doesn't get raw. So they gave me some samples of that, but I already had known about it, so I already bought a tube. I also bought some wipes with aloe in them, so I don't have to use the hard toilet paper. And then the guy that I know in Atlanta who just had this done recommended this travel or portable bidet that I bought online at Amazon already, so I can have it when I'm in the hospital. I think it was $12 or $13. It basically looks like an electric toothbrush style, or, sorry to use the term, but an enema bottle, except at the tip, it goes up and then comes down a little bit, and the end sort of like a shower head. So the bottle itself is squeezable. You fill it with water, and you turn it upside down, and you can go from the front or the back side and squeeze, and it works just like a bidet. So it gives a little bit of a forceful water spray to clean that area, which means you don't have to wipe so hard when you do go to clean. So I'm really thankful that Wesley told me about that, because like I said, I have that, I have my wipes, I have the calmoseptine, so I have everything I think that I'm going to need for Monday. And I think that's it for right now. So I'm probably going to try and make another video either Saturday or Sunday, just leading into the surgery, kind of how I'm feeling, what I'm thinking about, sort of thing, because this is a major achievement of this whole process. It's been 7 months since I started this, so things are a little bit emotional about it, to finally be getting rid of the ostomy and moving on to the final phase, the phase of this, because everything's been like you're having to get used to a new thing or look towards another surgery, and then you're going to have a different ostomy after that. You're going to have to get used to that and a different output, and things like that. So now we're at the end phase where whatever happens after this one is going to be how things, how the rest of my life's going to be. And I feel like I'm finally getting into that final phase. So one more thing I forgot to mention, my prep for this surgery is very easy. Sunday, all I do is drink clear liquids. I don't have any laxative to take, any bowel prep to take. It's just all clear liquids Sunday, nothing to eat or drink after midnight, I think, the morning of surgery. And that's it. So my surgery is Monday at 7:30. Today is Wednesday, so what, 4 days? Like you said before, can't wait, so looking forward to it. So I will keep you all posted. Like I said, I'll probably throw up another video before I go, and I'll talk to you soon. Bye.